Ibrahim Olabi, he's a lawyer at Guernica 37 International Justice Chambers, specialising in human rights law, and he joins us now from London. Welcome to the programme. Ibrahim, we just heard from my colleague Melinda about the challenges of distributing the Pfizer COVID vaccine due to that really low storage temperature. So what help will there be for poorer countries, particularly Syria and Yemen?
Thank you for having me. It's going to be a very challenging period, not just because these countries are poor, but these countries are also plagued with conflict. And there are kind of different areas of control that are controlled by different factions who have different political agendas, and the conflicts remain in both Syria and Yemen. So in addition to all the logistical challenges that you mentioned, there will be challenges as to who, even if those vaccines do get to the countries through the support of kind of allied proxies, for example, or through the support of development organizations, there are serious questions about the manipulation of these vaccines in terms of who's going to get them first, on what basis will they be kind of rolled out. I mean, we've heard in the UK that there's a clear strategy, when it comes to age groups and the most vulnerable. But I highly doubt that in countries where we've seen, such as Syria, we've seen manipulation of aid by the regime and its allies, that it will not do the same with the vaccines. It will start with the kind of the politically allied, the elites, the ruling party, and those are the ones that will kind of receive the first benefit. So in addition to the economic situation, there's also a lot of political consideration.
So is there anything that can be done to stop that?
Well, in the COVID, I mean, the whole idea is that, even if they do kind of politicize the vaccinations and use it as a kind of, we're scared that this will be used as a means of warfare in itself, that, those who sided with me during the conflict will get it, those who don't will not. But that's not how COVID works. Our kind of hope is that, because these kind of even the same areas of control or different areas of control in Syria are interlinked, and so are in Yemen, people do travel back and forth. There is a fear that if some people get vaccinated, others don't, it will get to you eventually, the virus. So it might be a chance that the fear of the spread and the pressure from international allies, because let's say, for example, the truce between Turkey and Russia breaks down in Idlib, and we see another refugee wave from Syria towards Europe, then, if Europe does not put pressure on everyone in Syria getting vaccinated, then unvaccinated Syrians may end up in neighboring countries and eventually in Europe. Because this is such a kind of a global catastrophe where everyone needs to be vaccinated in order for this to be kind of effective, we would hope to see more increased political pressure on those who want to politicize vaccination, that they should not do so for their own good.
You raise many important points, and just one, is there the money, the funding to actually get these vaccines to Yemen and to Syria? Because back in August, the UN said they'd received only 20% roughly of its 2.4 billion humanitarian appeal for this year.
I mean, that will be a challenge. But again, in both countries, in Yemen and in Syria, different groups there are backed by powerful regional and international allies. And they're backed militarily, politically, and also economically and financially. And so the hope is, because of the geopolitical interest of neighboring countries that are supporting warring factions, they will see the importance of getting the people that they support vaccinated in order for this not to kind of be counterproductive and backfire on them and their own populations, because Saudi is next to Yemen, Turkey is next to the north of Syria, obviously, and these are two kind of strong countries that require kind of even the warring factions in the respective countries to be vaccinated. Otherwise, it will backfire on them. So I think we will find the money, but the question will not just necessarily be the money, because there's a lot of countries that have the money but are unable to secure logistically or secure it's a waiting list, that these companies would not be able to produce for the demand needed. So the question would be not just how much money is needed, but where on the waiting list these countries are, and the lower they, because these are the countries that are unable to adhere to social distancing, they're unable to adhere to quarantines. They're the ones that might, seek refuge in neighboring countries. And so I would argue that they need to be higher on the waiting list than countries that are able to kind of adhere to domestic regulations in Europe, in the West, and elsewhere, because the danger of kind of COVID spreading from those conflict areas to the rest of the world is much higher.
And I just want to talk about Yemen, which, of course, the UN calls the world's worst humanitarian situation in the world. A hospital director was quoted as saying, "We don't have a neurosurgeon nor a maternity ward. Children are dying of malnutrition, dengue fever, famine. The coronavirus is nowhere near our biggest problem." So how bad is it, and how do you help these hospital health professionals?
Well, they're absolutely right. I mean, just yesterday in the TRT World Forum, there was a couple of Yemeni discussants talking exactly about that people are not seeing COVID as the main priority at the moment because, there are other issues that are kind of more of a priority to them. So that's absolutely right. I mean, even if vaccines come in kind, I think then they would accept them. But if kind of they're provided with the option of financial support to kind of procure the vaccines themselves or procure other goods and services, medical goods and services that deal with more priorities to them, then perhaps that would be the more reasonable choice to do, to go for non-COVID related matters. But that's the domestic choice. But again, internationally and regionally, the countries neighboring these conflict zones will be affected if those countries do not get vaccinated. I mean, in Syria as well, you've got the issues of the constant targeting of hospitals by the regime and Russia, which was reported in the UN Commission of Inquiry. So there is an issue of lack of hospitals to be able to deal, not just a lack of hospitals because that's the situations, because they're becoming deliberately targeted and medical professions are being persecuted. So even the infrastructure, once vaccines get there, in light of these international crimes, might not be there to roll out the vaccine in a proper way.
So many challenges and so many unknowns. Ibrahim, thank you so much. It's been fascinating to speak to you today on TRT World. Ibrahim Olabi, lawyer at Guernica 37.